Hey everyone, my name is Saral Desai, and I'm actually in psychiatry this year, and I'll be starting my residency at Tower Health Drexel University program in Philadelphia this July. And after I matched, I received a lot of questions from prospective candidates. So I decided to make this video answering one question each at a time so that I can provide them guidance. Now, before I start, I would like to mention that whatever I say in this video is going to be a combination of guidance from my mentors and my personal experience. And I would really like to thank everyone who helped me in this journey. It was a long and tough journey, so I'm really thankful to those. Now, there are no magic tricks in this video. Whatever I'm going to say is very logical and it's going to make a total sense. So I would really like to emphasize that it is more of a guidance. These are not insider tips that are going to make you match magically, because those don't exist. So now, without any delay, let's jump right into it. So one of the most common questions that I was asked by candidates was, can research and publications help you match in psychiatry? So I would say the answer is yes and no. Before we jump into this question, I would like to give you 3 questions that you need to ask yourself, which are very important for your application. The first question is that, can you do the clinical job? Can you do the job of a resident? The second question is that, would you be a problem resident? Would you be someone who would get along with others and won't create problems for the program? And then the third question is, what are the additional skills that you bring to the table? So when it comes to research, it is often considered an additional skill that you bring to the table. So it's very important that the answer to this question depends on whether your CV and your application and your interview performance reflects that you can do the clinical job and that you won't be a problem resident. Then comes the research, where your research experience and publication can make a difference for sure. Now, let's talk a little bit about how research experience can help your application. First of all, you need to understand that it's ACGME requirement. It's one of the core competencies that describes your ability of a resident to understand the latest research evidence, and incorporate that evidence in patient care. At the same time, you're also required to engage in scholarly activities, especially the quality improvement project during your residency. So if you have a research experience, if you have publications, then you're already someone who would continue to do that during your residency. You would meet that ACGME requirement without any issues. So you're giving the program one less reason to worry about you. Besides that, the research itself can reflect your personal attributes and your dedication to specialty. Because doing research is hard, it's time consuming, it requires a lot of motivation, a lot of collaboration, and persistence. So if you are someone who has done a lot of research and you have a lot of publications, especially in the field that you're applying, in this case psychiatry, then it does reflect your personal attributes, that you're someone who's hardworking, who's dedicated, who's resilient, and who's passionate about that specialty. So that's one of the area that research can help you in. Additionally, Research, if you're doing research which is impactful, then many times program directors are looking for people who would advance the field after they're done with the residency. So if you are someone like that, then you are more desirable to program, because ultimately there's so much that we don't know about brain and behavior, and we want people to advance the field. So that is the other area where you can um, prove yourself valuable to program by doing research. And I think the additional thing is that if you excel in any area, may it be research or any other hobbies or anything that kind of makes you unique while reviewing your CV, then that itself is a very powerful thing. So again, if you come up as someone who's dedicated to research and a lot of publications, then you can make yourself stand out compared to other applicants. And in that regards, research experience can also help you. So I think the bottom line would be that if your CV and your application already reflects that you can do the clinical job and that you won't be a problem resident, then you should, after your CV is able to answer those two questions, you should try to get research experience, and you can strengthen your CV by getting publications, and you can present that as an additional strength of yours. I think the best kind of research experience would be the one that you're doing along with your clinical work, because that's exactly what you would be doing during your residency. You would be doing your clinical work, and on top of that, you may engage in research and scholarly activities. So I think that would be the best way to go. Thank you so much for listening, and let me know if you have any additional questions. You can always comment in the comment box, and I would be happy to answer those questions. Thank you so much.